Our next speaker is a board member. He's a professor emeritus of the Department of Genetics, Cell Biology, and Anatomy at the University of Nebraska Medical Center. So we're very happy to have here Dr. Ernie Prentice.
Good morning, everybody. I'd like to thank the organizers of the conference for inviting me to beautiful San Diego. It's one of my favorite cities. This is one of my favorite hotels. I've been here about 12 times, I think. And every time I come here, I do have a problem, however. When I walk out the back, there are $1 million yachts everywhere. When I walk out the front, there are $1 million yachts everywhere, including a $400 million one that's out there, I think, right now. And I begin to wonder, did I choose the right profession? Because I can't even afford to buy a skiff. So, like Randy, I am not a wildlife expert. 55 years ago, however, I did do a wildlife project in Florida. It was at 3 or 4 bars at South Beach, Miami. And the project, as I recall, was unsuccessful. However, I do know a little bit about the regulations, PHS policy, the guide. Back in 1985, when the Animal Welfare Act Amendment was passed and the Health Research Extension Act that Randy talked about was promulgated, I got a call from the chancellor, and he said, "Now, Dr. Prentice, I want you to develop an IACUC for the University of Nebraska Medical Center." And I don't know what an IACUC was. I said, "Is that like acronym for IACUC you are clean?" Okay. He said, "No, that's like an IRB that reviews research involving animals." And I happened to be the IRB chair at the time. So I took it on and began another aspect of my career since 1985. However, in July I did retire, so that's why I'm a professor emeritus. But prior to that time, I served as IACUC chair for about 13, 14 years, felt like a lifetime sentence without parole. And then I did get paroled and got kicked upstairs to become the institutional official for another 5 or 6 years. However, I never went to jail. And fortunately, I retired before that was going to happen. So with that said, very quickly, you know a little bit about me now. I want to find out a little bit more about you. How many of you are wildlife researchers? Okay, how many of you are wildlife researchers on IACUCs? How many of you are wildlife veterinarians? How many of you are veterinarians who are not specializing in wildlife? How many of you are IACUC administrators? IACUC chairs? Okay. Anybody come off the street? Nothing to do in San Diego today? You know, I always seem to get assigned to talks first thing in the morning when everybody's asleep, prior to lunch when everybody's starving, right after lunch when everybody's asleep again, and at the end of the day when, you know, you've all had it. So I'll try to do the best I can to get us through to lunch time. I want you to look at this indictment, and I quote, "We're not destroying the world because we're clumsy, we're destroying the world because we're, or in a very literal and deliberate way, at war with it." You know, you far more than I can appreciate the significance of this quote. I spent my life in the ivory tower. You spend your lives out there in the field trying to protect wildlife and the environment. So I think this is an extremely important conference, and I'm really delighted that I have an opportunity to be here and to learn from you. So what we're going to talk about is principles for effective IACUCs, responsibilities of IACUCs, how you review protocols, and protocol approval criteria. First, 10 principles for effective IACUCs that review wildlife research. Now, I don't have commandments the way my friend Randy does, because, he has some sort of lineage related to Moses. Okay? I'm just going to have to stick with principles rather than commandments. So, number one, you who serve on an IACUC, you are actually society's gatekeeper. And it is your job, together with the investigators, to ensure humane use of animals in wildlife research and to ensure that it's justified by potential benefits. Principle number two, the IACUC needs to help foster a culture of conscience and compliance. And that means all individuals work together in a collegial and respectful way, in a partnership, to make sure that wildlife research is conducted with scientific validity, integrity, and reproducibility, the hallmarks of science. Validity, integrity, reproducibility. Number three, members of the IACUC need to get initial and ongoing training on the fundamentals of wildlife research policies at the institution and applicable federal requirements. Now, I'm going to tell you right now that the IACUC that I chaired for all those years was incompetent to review wildlife research. We did get occasional protocols involving different species, but as I recall of those times, we really didn't know how to ask the right questions. Principle number four, the IACUC needs to subscribe to the U.S. government principles and the guide, and those two documents serve as the ethical framework upon which the animal care and use program should be based and wildlife research should be conducted. And I've often said in talks that I give across the country, throw away the regulations, eliminate the PHS policy. If you follow those U.S. government principles, there are 9 of them, you will be conducting ethically valid research. Number 5, the IACUC treats all protocols the same with regard to humane care and use, but acts with informed recognition and adaptation to the unique circumstances under which wildlife research may be conducted. And they need to understand the differences between wild and laboratory-bred domesticated animals. They're not the same. You know this. There is something like 7 million odd species of animals that may be involved in wildlife research. But in the biomedical laboratory, for example, at my institution, we've got non-human primates, we've got rabbits, we've got guinea pigs, we've got hamsters, we've got pigs, we've got lots of rats and mice, we've got zebrafish, we got some reptiles, we got some other kinds of fish. That's a big difference between, the diversity that may be in a biomedical laboratory in terms of animal usage versus out there in the field. Principle number 6, the IACUC operates as an informed, cohesive committee, which includes wildlife biologists where possible, and all members have a voice and equal status. It's been said, if you don't know how to answer a question, you get a consultant. And having said that, segue, the IACUC knows what they don't know, avoids pretending to know what they don't know, and knows how to find the answer to what they don't know. Too many academics think they know everything. That's why they're academics, right? Number 8, the IACUC treats each investigator as a customer. We need to remember that the reason why I have IACUCs is to help our investigators do appropriate research that provides value to society, or in the case of wildlife research, to the animals, to the environment. Principle number 9, we need to recognize that it is often the IACUC that creates undue regulatory burden. It's not the regulations, folks. It's not the PHS policy. It's the IACUC itself. Number 10, noncompliance is going to occur when you pursue science. It's simply going to happen. So you investigate it promptly, fairly, and always place animal welfare first. Okay, ICA responsibilities and review and oversight. A lot of you are on an ICUC, so you already know this. So I'm going to go through this very quickly. What is an ICUC supposed to do? Well, they're supposed to inspect the institution's program for humane care and use of animals every 6 months. They're supposed to look at the facilities where animals are housed, or including satellite facilities. They submit reports of their evaluations to the institutional official. They review any concerns filed by anybody involving the care and use of animals and deal with them appropriately. They make recommendations to the IO regarding any aspect of the program. And of course, they review, approve, and require modification to secure approval or withhold approval of activities involving animals. The regulations and PHS policy do not mention the word protocol. It's research, testing, and teaching. Those are the activities that are under the authority of the IACA. They need to review, approve, or require modification to secure approval of any proposed significant changes. During the pursuit of science, you're going to have lots of changes. They need to be authorized to suspend activities involving animals. And as my friend Jerry Colleague often says, if you're not prepared to suspend or vote to suspend a protocol of one of your colleagues, get off the ICUC. And we need to make sure that whoever interacts with the animals are appropriately trained. We need to make sure there's an adequate occupational health and safety program. Report at least every 12 months the status of the program to OLAW if you are under a PHS assurance. And if you're doing USDA regulated research, you've got some forms that you have to submit at the end of each fiscal year relative to animal usage. So, ICUC protocol review methods very quickly. There are really two: designated member review and full committee review. Designated member review, at least one qualified ICUC member, got to be appointed by the chair, can serve as the reviewer. The process only begins after all ICUC members have had an opportunity to call for full committee review. An opportunity is usually about 5 days on average. ICUC members don't vote in the DMR process. And the designated reviewer can go ahead and approve the protocol, modify the protocol. They simply can't disapprove the protocol. Full committee review. Convene face-to-face meeting is preferable, although you can use real-time electronic communication. Got to have a quorum, simple majority. And they can do everything, including disapprove a protocol. Now, this was a pretty significant guidance issued by OLAW with USDA concurrence back in 2014, which allows significant changes to be reviewed via a process called VVC, Veterinary Verification and Consultation. And I don't want to really go through this in any detail because we really don't have time, except to say this was a really, really important guidance document issued by OLAW that allows basically for you to call up a designated veterinarian and say, you know what, I need to take some extra blood samples of whatever the species is. Can I do that? And literally, the individual who is the designated veterinarian for the VVC process can say, okay, why do you need to do it? And how are you going to do it? And then what's the volume? And okay, you're good to go. Prior to 2014, you couldn't do that. You'd have to go through the DMR process or full committee review process. But you got to have a policy that allows you to do that. Okay, moving on, elements of protocol review. Now, I'm not going to talk about field studies. I'm going to talk about interventional wildlife research. And I need to tell you that I got to give credit to Bob Sykes and Ellen Paul. The document you produced, the guidelines from your American Association of Mammalogists, and the model wildlife protocol that you and Alan Paul produced, that is a really, really valuable document that everybody's got to got to look at that. And I know you've got some copies out there of your guidance documents. So I divided up this protocol review into 14 sections. Section 1, Federal Oversight Authority. You got to know who you are accountable to. Is the research subject to the Animal Welfare Act regulations, USDA regulations, PHS policy, and the guide? So the protocol's got to comply with any applicable requirements in those documents. Now, I might add that OLAW has issued guidance posted on their website, which is their interpretation of the PHS policy. You need to look at that because they expect us to comply with that guidance. APHIS has issued animal care policies, which reflects their interpretation of 9 CFR. They expect us to comply with those policies. And of course, everybody should comply with the guide no matter what. So what about the IACUC Oversight Authority? We talked about that a little bit earlier. If you have a PHS or an NSF-funded interventional or field study involving live vertebrate animals, subject to IACUC oversight. However, let me clarify. The field study, if it is a legitimate field study, does not require IACUC review of a protocol. However, it does require, according to PHS guidance, the IACUC or some other mechanism to determine that it is indeed a legitimate field study. And you already had the definition of a field study, so we won't go through that. Interventional studies involving USDA-regulated species are subject to IACUC oversight as well as IACUC review of protocols. Field studies involving USDA-regulated species are exempt from IACUC oversight. However, USDA has the same attitude as does OLAW. You got to figure out whether or not it is indeed a legitimate field study. Something as subtle as you're doing an observational study out in the field and an animal gets your scent, you've altered their behavior, that's no longer a field study. So you need to think about that. Now, if you're ALAC accredited, you have to comply with the guide, obviously, as well as ALAC standards. And a lot of institutions, they don't really care if it's a field study or if it's an interventional study. They want to have IACUC oversight and IACUC review of protocols involving both interventional and field studies. Section 2, select animal species, animal numbers, and location of research. You got to ask some questions. Which species will be used? Why'd you choose that species? What's the minimum number of animals that you need to achieve scientifically valid data? What's the scientific or statistical rationale in support of those number of animals that you need to use? And are the animals an endangered or protected species? So what about protocol review criteria, approval criteria? When you take a look at the answers provided by the investigator, well, the species selected has got to be the appropriate one. What's appropriate? Something that is scientifically and biologically appropriate in consideration of your aims of research. And again, required number of animals have got to be supported by sound scientific and statistical justification. And any use of endangered animal species must comply with applicable law. And I really don't know a lot about that, but I've got to tell you that you better make sure you got the right permits. So now you know what species the investigator wants to use. Well, where, okay? Where's the field location? Is it a state within the U.S., U.S. parklands, wilderness, private land? Is it a marine location? Or is it international? And I think the IACUC needs to know something about the field location. What's the terrain look like? What's the weather look like? What are the temperatures? Okay? What's the variation in temperatures between, morning and night? And you may be going beyond the field and also having some of the research after you've collected the specimens at an institution. So where are the institutions located? Who are they? Have all federal and state required permits been obtained? I love that session that Bob conducted, okay? So I'm not going to go through that. But you got to have the right permits. Now, you had a little bit of debate about, okay, do you have to have the permits prior to ICAC approval? Well, my view is you have to have the permits prior to beginning the research, okay? I don't think you need to hold up the protocol review waiting on the permits, but you need to get the permits. And if you take a look at the permits, that could possibly alter, okay, another look at the research by the ICAC because you didn't have all the answers. Acquisition and transport of live animals, Section 3. What's the anticipated number of target animals that will be captured? Now, it's anticipated. You're probably not going to know for sure. You know that better than I do, okay? How will the target animals be humanely captured? Are you going to trap them? Are you going to use chemical immobilization? You know, the most ICAC members, certainly in a biomedical ICAC, they have no clue as to trapping methods. No clue. Frequency of monitoring traps, extremely important. And are there any alternatives to capture? Will the animals be marked or tagged? If so, what kind of a marker? What kind of a tag? How are you going to attach it? What's the effect on the animals? These are all questions that ICACs need to address, and it's really important for somebody like me who knows nothing about this stuff to get answers to these questions because the questions make sense to me. But if I don't know enough to ask the question, okay, then I can't even evaluate the answer. So, whatever trap or capture technique that is chosen, it's got to be the most humane possible given any justifiable scientific, environmental, or other constraints. You got to check the traps at an appropriate frequency. So I would expect the investigator to tell me, okay, I'm going to check the traps once a day. Well, I would like to know why once a day. Why not every hour? Or why not every 2 days? There has to be a reason. And of course, trapped animals should be alive and uninjured. If they are injured, then that's a problem. That's an adverse event that should be reported to the IACUC. Now, will animals be transported from the capture location? Where are they going to go? How are they going to get there? What's the housing during transport? Is there a necessity for immobilization or anesthesia? How long is it going to take for them to get to their destination? And how are they going to be monitored during transport? All logical questions for an IACUC to ask. And the transport of live animals within and from field sites have got to be humanely conducted. Procedures have got to be in place to ensure the health and well-being and comfort of the animals. And you have to appropriate caging, food, water, and monitoring. These are all questions I think the IACUC should be asking investigators to supply the answers to. Now, what about non-target animals? You wildlife people know this. At times you're going to capture non-target animals. It's not what you want, but you're going to get them anyways. Okay? What species of non-target animals do you think might be captured? Provide a list to the IACUC. How many? Estimation. How many of the non-target animals by species do you think you might end up capturing? And then what about, are you going to release the non-captured animals into the wild or not? Well, why? How? Potential adverse effects? Are there any applicable federal and state regulations? In general, non-target animals are often released back to the wild. So, IACUC approval criteria: captured non-target animals may be released back into the wild with support and justification. Any required permits are humanely euthanized. And you always consider the welfare of the animal first. Section 4, living conditions of animals. Where are the animals going to be housed? Are they going to be housed in the field, or are they going to be housed in the institution's housing facility, or both for a while? Maybe there's a sequential series of procedures done, first in the field, then at an institution. And how long are they going to be held? Do you need to alter the animal's living conditions? Why? And will target animals be released back into the wild? Why? How? Are there any potential adverse effects on both the animal and the local population, the ecosystem? And are there any applicable federal and state regulations? The permits are going to address whether or not you can release animals back to the wild. So, approval criteria. The living conditions of animals have got to be species appropriate and contribute to the health and comfort of the animals. You know that. Okay? If you deviate from that, set forth standards by the USDA regulations to guide, you've got to justify it. Has to be approved by the IACUC, and it has to be documented. And if there's an intent to release animals back to the wild, strong justification has got to be provided and any required permits obtained. And you always consider animal welfare and the ecosystem. It's my understanding that, generally speaking, target animals, after they've had interventions performed, are usually not released back to the wild if they've been housed at an institution for any length of time. But you know that better than I do. Scientific aims and procedures. The IACUC needs to know, what are the aims of the research? What do you want to do? What are your objectives? What's the experimental design? Are you going to perform surgery? Is it major, minor, survival, non-survival? What about the non-surgical procedures? And where are you going to be doing these procedures? In the field? In the field and at the institution, or only at the institution after the animals have been transported there? So IACUC approval criteria. The experimental design has got to be sound and supported by and support the stated scientific aims of research. It's got to be clearly explained. If you have a flawed experimental design, you got bad science, the IACUC should not be approving the protocol. Procedures have got to be conducted in appropriate field and or laboratory facilities, again in accordance with the PHS policy, USDA regulations as they apply, and the guide. And if there's more than one major survival surgery in a single protocol, it's prohibited unless it can be scientifically justified, unless it's necessary for clinical care, or if it's USDA regulated, you can get an exemption from USDA by applying to APHIS. And of course, the research must not be unnecessarily duplicative. Now, I give a lot of talks on the IACUC's role and responsibility to review the science. And the 8th edition of the guide really helped my job in trying to convince investigators and IACUC members that it is the IACUC's role and responsibility to review the science. Now, page 26 of the guide, and I quote, the IACUC should evaluate scientific elements of the protocol, e.g. hypothesis testing, sample size, group numbers, and adequacy of controls. It doesn't say the NIH study section. It doesn't say some other peer review committee. It says the IACUC. Now, granted, if you've got a protocol that are just in time, or you've got a legitimate peer review committee, that certainly, can aid the IACUC in performing this particular responsibility. But nonetheless, bottom line is, it's the IACUC's responsibility. Treatment of pain and discomfort, section 6. What is the estimated magnitude and duration of pain, discomfort, distress, which requires treatment? And what's the treatment? The agent, the dose, the route, frequency, duration, and any non-drug treatments. Now, we all rely upon our veterinarians, who are the experts, to tell us, well, you know, this is the best treatment. And I understand that and I accept that. However, we have to remember that our veterinarians are only one member of the committee. They got one vote. Therefore, you simply don't just pass the buck to the veterinarians about any aspect, okay, of treatment of the animals. You need to be convinced as an ICUP member, yeah, that makes sense. It makes sense because I'm now convinced they're given state-of-the-art sedation, analgesics, anesthesia. I'm convinced it's being given appropriately, preoperatively, intraoperatively, postoperatively. And I'm convinced that, yes, based upon the species, strain, nature and length of the procedure, type and degree of pain, safety of the agent, this is the right pain relieving regimen. And of course, we all know that withholding pain relieving agents is rarely acceptable, and it's really got to be justified for scientific reasons. Post-procedure monitoring, section 7. Moving on. What's the monitoring plan? Frequency of observation. And are you going to record any clinical parameters? I mean, how are you going to know the status of the animal if you don't record clinical parameters? And who's going to carry out the monitoring plan? Because the monitoring plan's got to be dictated by the species, what you did to the animal, the degree of potential pain, discomfort, distress, how long it's going to last, possible complications, and the need to recognize when the humane endpoint is reached. Now, the humane endpoint is the point at which the clinical signs indicate that that pain must be relieved either by euthanasia or administering an appropriate pain relieving agent. When you design a protocol, you need to attempt to align the experimental endpoints, which means you've reached the point where you have got the data to satisfy, okay, your objectives, with the humane endpoint. They should be synchronized. Otherwise, you are prematurely euthanizing animals, and perhaps you've not reached the point where you've got the data that you want. So both investigators and IACUCs need to take a close look at experimental and humane endpoints. Well, what about restraint? Now here I'm not talking about a trap. I'm talking about the animals in the facility, or I guess it could be a field facility, and you need to use a mechanical restraint. Okay, why? What is the device strength? Is it the most humane device possible? And how long will the period of restraint be? I'm sure we all remember prior to the 1985 Animal Welfare Act amendments that non-human primates were chaired. They were chaired for days on end. That would never happen today. So you evaluate the investigator's response to the questions by saying, okay, use of the restraint device has got to be justified. The animal's got to be conditioned to the restraint device. The duration of restraint's got to be minimized. The restraint device should allow normal postural adjustments. Got to monitor the animal appropriately. And any animal that can't adapt to the restraint device has got to be removed from that device. Section 9, euthanasia, humane killing. In a biomedical context, we don't use the term humane killing, we use the term euthanasia. However, in a wildlife research, that is a common term. So what's the criteria for euthanasia? That's the experimental endpoint. What are the methods of euthanasia or humane killing? What's the rationale that supports the choice of those methods? How are you going to confirm death? And is there a residual impact on the environment and or secondary scavengers? Of course, that's unique to wildlife research. You need to think about that. And how's the carcass going to be disposed? That should be in the protocol. And I think someone raised that issue relative to permits earlier. So the protocol approval criteria, the method of euthanasia, humane killing's got to comply with the AVMA guidelines. However, we all recognize that deviations may be necessary in wildlife research. It's not the same as a biomedical laboratory situation. So those deviations are going to be approved by the IACUC. And they need to be based upon species and size of the animal, what are the objectives of the experiment, any logistical considerations, safety and emotional well-being of personnel, minimum pain, distress associated with the method, and ability to quickly produce a loss of consciousness and death of the animal. Section 10, Principles of Replacement, Reduction, and Refinement. The genesis of the 3 R's came from Russell and Birch. They wrote a book in 1959, and like Randy, I do like history, and I give a lot of talks on history. I've always wondered why it took until past 1985, when the Animal Welfare Act was amended, for us to pay any attention to the 3 R's in this country. And it really wasn't until the 8th edition of the guide where the 3 R's were emphasized appropriately. And I quote from page 5 of that guide, "The 3 R's have become an internationally accepted approach for researchers to apply when deciding to use animals in research and in designing humane animal research studies." Too many IACUCs, in my view, don't spend enough time trying to help investigators understand the need to apply the 3 R's when it is possible. So you need to ask the question when you review a protocol. Has the investigator appropriately incorporated each of the 3 R's into the protocol, which are scientifically feasible, because they may not all be scientifically feasible, reasonably available, and most importantly, applicable in a wildlife environment? Again, making the distinction between biomedical research conducted in a laboratory versus out there in the field. But if we can achieve an objective by utilizing a reasonably available non-animal model, maybe mathematical, computer, in vitro, well, we need to do that. We need to reduce the number of animals as much as possible, consistent with sound scientific and statistical standards. Now, one of the things that our IACUC had often done was we reviewed the required number of animals, the experimental design, and we told the investigator, you don't have enough animals. Your end's not big enough. You don't have enough controls. In those cases, we actually required an increase in the number of animals. Otherwise, the research would have been invalid and the animals wasted. Refinement. Procedures must be used that have the least amount of potential pain, discomfort, distress, morbidity, mortality, consideration of any justifiable scientific constraints. Examples of refinement: if we can use a less invasive procedure, fewer, state-of-the-art pain relief, talked about that a moment ago, less restraint time, talked about that a moment ago, environmental enrichment, that really doesn't pertain as much to wildlife research because they're out in the environment, okay, than it does for biomedical research in the laboratory. Highly attentive monitoring, more humane euthanasia, and use of humane endpoints. And once again, I want to emphasize the experimental and humane endpoints. I told you a little bit about that earlier, so we're going to do it again. The experimental endpoint occurs when the scientific aims are achieved. The humane endpoint is the earliest possible point at which pain and distress are prevented, terminated, or relieved. And again, experiments should be designed so that the experimental and humane endpoints are closely linked. They are synchronized. And the protocol should address a study endpoint that is both humane and scientifically sound. Now, one of the problems I had as a IACUC chair was we would have investigators that would specify the humane endpoint. Now, back in those days, the term humane endpoint didn't exist. We called it premature euthanasia. They would specify that in the protocol. And then I would find out that animals were allowed to go beyond the point at which they were supposed to be euthanized. And I would have a fit because we did a lot of cancer research at our place. So I was constantly encouraging the IACUC and our veterinary staff to ensure that when the humane endpoint was reached, that those animals had to be either euthanized or appropriately treated. And if you're USDA regulated, relative to the 3 R's, you have to provide a written narrative describing the methods and sources used to determine that alternatives to painful or stressful procedures were not available. And that documentation requires a lit database searched, or perhaps 2 other sources, like consultants. The data of the search has got to be up to date, current. Years covered by the search have to be appropriate. Keywords and search strategy have to be appropriate. And reduction, replacement, refinement, all 3 R's have to be addressed. We have been cited a number of times by USDA VMOs on not having adequate searches. I can remember a time when I was IACUC chair. No, I wasn't IACUC chair, I was the IO. VMO came in, looked at about 10 cardiac physiology protocols. They were all very similar, and they all had the same narrative. And the VMO said, you know what? Yeah, they are similar, but the keywords should have been a little bit different for each one. So we were required to go ahead and do a search over again for every one of those studies. There's a lot of alternative search guidance available. This is going to be in your slide. This is a quote from one of our medical center PI's protocols. After extensive review of the literature, the only suitable replacement for a live animal is to use university administrators and federal regulators who don't understand the needs of my science. Okay, I think they were probably thinking of Axel Wolf. Okay, here, Axel. Okay. They're probably thinking about me. Okay, so when this was brought to my attention, okay, as the IO, by the IACUC chair, and I had a chuckle, thought it was funny, and then I called up the PI, and I said, you know, you're doing research with hamsters, and hamsters are USDA regulated, and the VMO could show up tomorrow, and you know, if they see this, you know, we're liable to get in trouble. So do you suppose you could maybe revise it? And he laughed, and he said, sure. Okay, and then I put him on the IACUC. And actually turned out to be a great IACUC member. So, moving on, okay, making sure I don't go into lunchtime. Section 11, potential benefits of the research. Well, you know, ask the investigator, okay, what are the potential benefits? What's the value of the research? Why do you want to do it? Okay. So, approval criteria. Let me read this verbatim, word for word. I might even read it twice. Research should be designed and conducted to provide potential benefit. Potential benefit. You can't guarantee benefit in research. Potential benefit. Sufficient potential benefit, I'll throw that in, to wildlife, animal health and well-being, the ecosystem, human health. I mean, probably most wildlife protocols, don't have a human health benefit, though some do. Advancement of knowledge or the good of society. That is an alteration of U.S. government principle number 2, to throw in a wildlife, bent to it. We're going to come back to that a little bit later. Section 12, qualification of research personnel. Who are they? What are they doing? And do they know how to do what they're assigned to do? You've got to be knowledgeable about the biology of the animal subjects. And considering the diversity of wildlife research, boy, you're going to have to know, what you're doing. And they got to be fully qualified to carry out whatever their assigned responsibilities are, and those qualifications have to be documented. Occupational health and safety. Will any personnel be exposed to health hazards? What are they? Are we talking about health hazards that are related to the field, to the environment, to the temperature, the weather, the terrain? Or are we talking about in the laboratory once the animals are transported to the institution? Are the risks minimized? Have personnel undergone health screening? Are personnel adequately trained and protected? Is IBC and OSHA review and approval required? There's a lot of health hazards in animal research. Rabies, hantavirus, herpes B, so forth and so on, and of course, bites. You're out there in the field and you're dealing with wildlife. Maybe you're trying to remove them from traps. I've never done that before, but I would assume that animals are not very happy being in a trap, and they probably might take a chunk out of you if they could. So personnel need to be trained to handle that, and it's up to the IACUC to make sure that they are comfortable that the individuals, be they investigators or graduate students who are investigators, know what they are doing. Now I throw the next slide in, just because. This is obviously a great white. And when I was an undergraduate, I almost became a marine biologist. And I sometimes regret that I didn't become a marine biologist. I might not have had a big yacht like those out there, but I probably would have had a boat, and I probably would have been hanging out in the ocean, and I do like the ocean. So there are risks of being bitten by your subjects. Now, relative to this fellow here, if you look at the data on shark fatalities, it's somewhere around 8 per year. So your chance of getting struck by lightning may be higher than it would be to get munched by a shark who wants to have you for lunch. However, you're going to have IACUCs out there who don't know anything about wildlife research, who are going to be really risk adverse, and they perhaps are trying to be more overprotective, and consequently they impose restrictions that are unreasonable. So my view is there needs to be a dialogue between people who know what the hell they're doing and the IACUC who may not know what they're doing, so that they come up with the right protections. And we need to remember that the IACUC is not in charge of running an occupational health and safety program. They're in charge of ensuring that it is an effective occupational health and safety program. Section 4, the last one, ethical cost-benefit relationship. To me, this is the most important aspect of ICUC review. Nowhere do you see in the USDA regulations or the PHS policy a reference to ethical cost-benefit relationship, or as it's often called, harm-benefit relationship, which I don't like that term. I'll tell you why in a moment. However, there is a subtle reference in the 8th edition of the guide. And if you look at the U.S. government principles, and if you look at the requirements of both the USDA regulations and the PHS policy, you can extrapolate that, you know what? IACUCs need to make sure that there is an appropriate ethical cost-benefit relationship. We need to ask the question, is the ethical cost-benefit relationship with the research acceptable? Because if it's not, you can't approve the protocol. So what exactly does this mean? Well, the ethical costs are the harms of the research inflicted on animals, i.e. pain, discomfort, distress. In a biomedical context, morbidity, like in our cancer experiments, and mortality. Those are harms. Those are ethical costs. And those ethical costs have got to be outweighed or balanced, at least, by the potential benefits, i.e. the value of the research. Two, wildlife animal health and well-being, the ecosystem, human health, advancement of knowledge, or the good of society. Once again, that is a redo of U.S. government principle number 2, which I think is the most important of the 9 principles. Now I get to the bottom line here. The use of animals in a biomedical context or a wildlife context, it's a privilege. No investigators have a right to use animals. This is not an issue of academic freedom. Academic freedom's got nothing to do with it. Academic freedom allows you to choose the area of research you want to pursue. It does not give you the right to pursue it unless you have approval by the IACUC to do so. And society demands that the animal use be justified, be humane, and be ethical. And ethical research is characterized by 6 R's. I don't have 9 R's like Randy does. Okay, I only got 6. Okay, but I would suggest that all 6 apply to wildlife research. And of the 9 that he had, I would say these 6 are the most important anyways. Replacement, reduction, refinement, well, those are the traditional 3 R's, right? And then responsibility. Investigators have to be responsible. Investigators should function in a culture of conscience and compliance where everybody does the right thing because it's the right thing to do, not because you got some regulations that tell you have to do it, not because you have an IACUC that tells you have to do it. It's because that's the right thing to do. You respect the animals. Reproducibility. There's a lot of concern nowadays that the stuff that we do is not reproducible. Whether we're talking about animal research or human subject research, it's not reproducible. If it's not reproducible, it may be invalid. If it's invalid, we're wasting the animals. And God knows what we're doing in terms of risking humans when we talk about preclinical research that leads to approval of new drugs. So it's a big concern, and you all know that NIH is very concerned about it as well. And then, of course, respect. again, respect for the animals, respect for each other who take care of the animals and do research. And thank you very much for inviting me and listening before lunch. And I have 5 minutes. I will entertain questions, or you can throw money. I'm retired, remember? Okay.
Not a question, but a comment, Ernie. One of the points of confusion I think that a lot of ICUCs wrestle with is when an activity requires oversight and protocol review and approval, and when it does not. This is one that Ernie touched on one of his early slides. There is a difference between USDA expectations, USDA language, and OLAW language, and actually even some of the taxon guidelines. This is something that I know we're going to hammer in coming days, so extensive discussion now is probably premature, but specifically the USDA regulations talk about the field studies exemption, and that is material alteration of behavior, harm, invasive procedure. The IACUC is the one charged with identifying that. They provide a little bit of guidance in the facilities inspection guide, but it comes down to the IACUC deliberating on that, and that's a gray area. OLAW has guidance on that and their FAQs, which is their interpretation of the PHS policy, and it's more restrictive. So in effect, if you are doing anything other than something that is completely no touch, then it needs IACUC oversight. So this is and then even the taxon guidelines, I know the Mammal Society guidelines hammer this more. This is something that we're going to come up with in future days, specifically tomorrow. But as we do the breakout sessions, I really encourage you guys to focus in on this question, because this is something that ICUCs really, really wrestle with.
So thank you, Bob, because actually you read my mind. I just want to make sure when we're talking up here in some of the presentations in a sort of convivial way, we talk about field studies, terminology matters. So we're not in general referencing the AWA language of a field study as it's defined in the regulation. We're talking more generally about field research or field activities. So I just want to be careful, and we use this terminology going forward, that if we see presentations that talk about field studies, we're talking in the generalities, not in the regulatory language for the most part. And the other thing I just want to mention is we'll talk more about on the issue of permits and the kind of language that might need to go into a permit, be it migratory bird treaty permit or collection permits or others, about euthanasia. We'll talk more about that, because in some cases you might need to actually include language that says you might be euthanizing animals in the field as part of your collection permit. But we'll get to that later, and Ellen Paul will be here a little bit later today as well. Thanks.
Ernie, thanks for the talk back here.
Okay.
Your presentation is very much on the biomedical and scientific side. Would you say a few words, please, on teaching and training using animals in the field?
Sure. First of all, if you look at activities, and I mentioned that earlier, it's research, testing, and teaching. The regulations and the PHS policy apply equally to teaching. However, okay, when you have a protocol that involves teaching, particularly in my circumstance, in biomedical context, if you look at a lot of the questions that are normally asked on a biomedical protocol, they don't apply to teaching. You can't figure out how to answer the darn questions. So what I recommend for biomedical protocols that involve teaching is that you change the way the questions are structured so that they are compatible, okay, with teaching. Okay? Now, I would say the same thing would probably apply to wildlife research. Some of the questions are not going to be, they can't be the same. Okay? They simply can't. For example, if you could say, okay, how many animals do you need? Well, it's not. There's no statistical justification. There's no scientific justification. There's a teaching justification. There's an educational justification. That's how the question's got to be structured. Alternatives. Okay. What are the alternatives? Well, there are all kinds of in biomedical research. There's all kinds of alternatives to allow us to conduct training without utilizing live animals. Now, I trust that that's not really the case as well, okay, in wildlife research. So I would think that you need to take a very close look at your protocol review forms for teaching. You may want to have a separate one, perhaps, okay, and structure the questions to fit the activities that you are going to evaluate. And having said that, I want to reiterate one of my colleagues often said pieces of advice. Every single question you ask an investigator to answer has a cost benefit attached to it. Okay, the cost is the time it takes for the individual to answer the question. What's the benefit? You need to ask that. You need to say, why? Why do we need to know the answer to the question? So I would encourage everyone here to take a look at your protocol forms and say, okay, why are we asking this question? Do we need to ask this question? Or maybe you're going to say, you know what? Maybe we're not asking enough questions. It doesn't really matter how you approach it. The point is you're assessing what you're doing. Okay? And I am holding you up from lunch at my danger to my health here. Okay. So Greg is going to go ahead and give you the luncheon instructions. Greg? Okay.